everyone.
Hello.
My name is Maree McRae. I'm with Heart Mind Connect and Audrey, and NAMI Public Policy Committee. Heart Mind Connect is starting supportive housing. I'm happy to say this was from my personal life experience with the lack of that. And I think that she's looking for the video. She'll let me know we're done. So. This is Diane. I lost my best friend of 32 years to suicide, in which she came to the ERs to get help, and they failed her 4 times, the last time saying there were no long-term treatment beds that they could find for her. I also want to mention in remembrance of young adults that we've lost in my small personal circle. Micah, 24, Chelsea, 25, Ryan, 22, Kevin, 20, Russell, 25, Amanda, 21, and Shane, 24. Also, all lost to ER holds where their job should have been to give proper treatment, like any physical illness, to those that were critically sick with brain disorders. Even now, as I speak, 4 days ago, my son was released after his 5th M1 hold by Swedish Hospital, who failed to follow the law and released him even with the specific details from Mental Health Center of Denver's crisis team that they needed to find my son long-term treatment and not release him, as this was his 5th hold in 7 weeks with nearly fatal alcohol poisoning to drown out the voices from his schizophrenia. I believe we must immediately work on solutions where people are told to go to ERs and they're dying coming out of there. And they're dying to the tune of $25,000 per day. I mean, what could we do with this money? It's outrageous to me. The government has spent $500,000 on my son, and he's still in the same place because we stabilize, we don't do treatment. So I think that's just critical, and I can't possibly understand why this can keep happening in the hospitals, and we need to have alternative crisis centers that can actually do something to help people with psych beds. My son last summer had taken himself into St. Anthony's ER in Lakewood. They held him for 5 days, in which time he was left in a stark room without treatment as he decompensated. He was without a toothbrush, without shower, and meals had to be reminded to them. When I told them this was not acceptable, the response was they were terribly sorry, but they were a trauma unit and really were not trained properly for psych beds. Even the head of the ER, Mr. Goldstein, reiterated to me that he couldn't seem to get proper training to his staff for the psych beds. So all of the people that I mentioned earlier, my loved ones, were not ones who hid in silence with their illness. I can't do anything about people that choose to not talk about it or stay. I can feel horrible for them, and we can keep talking about mental illness, but these are people that came forward and in the system tried to get help for being critically ill, and they were let down, and their lives were lost. And we can talk about suicide prevention all we want. And that's fine maybe for a high school student that broke up with a girlfriend. And I'm not minimizing any of those situations, or I'm not minimizing them. Depression can happen to each one of us. But I'm talking about what are we doing for those that are severely mentally ill? What are we doing for them? And suicide prevention and all the money in the world can go into it. And we don't have treatment beds, and we don't have options. It's just, I don't understand how money can keep flowing in all the wrong directions when we're continuing to have such high statistics in suicide and mental health treatment options we're so low in. And I'm not proud of this state, of being in a state where this goes on. My son also had a horrific time trying to get a bed at Fort Logan. He was moved from Jeffco Mental Health Center to Arapahoe because Jeffco Mental Health Center stated that he was too complex. What does that mean? And there were more programs at Arapahoe. So, moved him there. Then when he needed a bed at Fort Logan, they didn't have allotted beds there. And demographics should not play a role of somebody being able to get a treatment bed, whether you have schizophrenia at Kipling and Bowles or schizophrenia at Mineral and Santa Fe. Again, that's just, it's mind-boggling. I don't understand that. The lack of beds, again, as people have mentioned, is unacceptable. To have 93 civilian beds or 94 for 5.6 million people is an atrocity, and it's a humanitarian crisis. Again, my son, because of demographics, could not get a bed. And even when he did, the top doctors there sat down and told me, the psychiatrist, that he couldn't get the one-on-one that he really needed, that they just did not have the staff and the funding for that. So again, stabilizing and not having treatment, and also gigantic is no continuum of care after they're released from the hospitals. My son had to be sent sick across the country to Connecticut for supportive housing after hospitalization. And I had a choice of over 60 facilities for young adults, and young adults. Our young adults don't belong in a senior living, assisted living center, which were the only option that we even had there, and even those were full. So I had a choice of over 60 facilities for young adults, and again, could not find one in Colorado for his needs. Finally, I want to say, as much as I'm fully aware of the horrific crisis in the jails and those awaiting competency restoration, I would like to say that my personal life experience was a son who tried to stay out of the criminal justice system, whose psychosis was extremely dangerous to himself and to others, and who went, which that must be very difficult, and I am grateful he has an awareness. But what good is that if the message to him is, and also his ACT program, we have to take away his ACT program because the people in jails get first dubs on that. The people in jails get the treatment bed. And he gets it, and what's sad is that he looked at me and said, do I have to be a criminal? Is that what I have to do to get treatment? Maybe I should be a criminal. So, and I hear your story in the criminal justice system, and it's horrific, but I want you to understand that my story is horrific, and my son is denied programs because we have this huge issue, of course, with those in jail, with those out of jail, the civilian beds, and with my son trying not to get in the criminal justice system.